Okay, so welcome everyone. We're going to make a start. We might have a few people come during the presentations, probably ducking their heads to get some food. My name's Mark Harris, for those of you who don't know me. I'm a Professor of General Practice at the University of New South Wales, and I'm also Deputy Director for the Translational Cancer Research Centre, which is based at University of New South Wales. So welcome to this Shared Care workshop. I'd like to start by acknowledging the traditional owners of the land we're meeting on, the Bidjigal people of the Eora Nation, and pay my respects to their elders past and present. And welcome all of you here. I think as GPs in the audience should be feeling pretty fortunate because we've got a pretty stellar group of people to present and interact with you. This is meant to be an interactive workshop, so we'll try and engage with you as much as possible and allow lots of opportunity to ask questions and raise issues with us about shared care for cancer patients, particularly for colorectal cancer. So these are the learning objectives: to be able to identify the prevalence of colorectal cancer and some of the survival statistics for it, to describe briefly screening programs, which we're all aware of, and the diagnosis of colorectal cancer, some of the current management principles and modalities, which are changing all the time, but fortunately we've got people who are pretty expert in that to bring us up to date with that, to identify the role of general practice in the long-term care of survivors of colorectal cancer. So we'll be talking about that and what that role might be, and that links with a project that we've started based at St George to support care planning for patients with colorectal cancer, and we'll talk about that more later. And to identify how we can support cancer survivors to manage their lifestyle risk factors, such as smoking, alcohol, diet, and physical activity and weight, and review and the recording and monitoring options for shared care. So these are some of the presenters. Apart from myself, Associate Professor Winston Lau, who will be working in a moment, Professor David Golston, who's from Prince of Wales, who's a medical oncologist, also the director of the Translational Cancer Research Network. Dr. Nadine Baidoun, who's a radiation oncologist here at St George, and Dr. Melvin Chin, who's a medical oncologist at Prince of Wales Hospital. As I mentioned, you'll be getting you've got quite a stellar group here who's going to keep us all informed about the management of colorectal cancer. So the program, briefly after my introduction, we'll be having a talk by Winston, who'll be talking about both the incidence of survival of patients following the screening program and some of the early and late presentations of colorectal cancer, including some of the management principles and modalities. And then we're going to have some case vignettes where we'll be talking about patients with colorectal cancer. We were going to split you into small groups because we're expecting a slightly larger group, but we'll probably keep you as one group and interact here. We're also then going to have a presentation by Melvin on the shared care arrangements, particularly the arrangements we're proposing for shared care based here at St George. And then I'll finish up by reviewing what we've learnt and encouraging you to fill out the evaluation forms and talk about some of the next steps that we'll be taking. So this series of presentations and the interactive discussions is being videotaped. If any of you have a problem with that, then let us know. We'll try and make sure we don't capture you in the frame. the purpose of that is simply so that we can make this available to others who can't be here tonight, other GPs who can't be here tonight. It's not going to be put on, free-to-air television. So after the workshop, we'll ask you to, as we did before the workshop, to review a patient of your own who's got colorectal cancer, and to complete the online reflection form, and that completes the activity. So we wanted to start the session just by setting a scene for you to think about during some of the presentation. So Joanne is a 68-year-old retired bank worker, and she's married with 2 children and 1 grandchild. And she presents with rectal bleeding and tiredness. She doesn't have a family history of colorectal cancer, and unfortunately she didn't participate in the screening program. She didn't like the idea of collecting the fecal sample. So she was referred for a colonoscopy, and that revealed a sigmoid colon tumour. And the CT showed some enlarged regional lymph nodes, but as yet no evidence of hepatic or lung secondaries. Her CA level was about 119, and biopsy of the sigmoid mass showed that it was adenocarcinoma. So I'm handing around that case, and I can get it to move to the next thing. Yep. Just like you to reflect on a couple of questions which hopefully you'll be able to address at the end of the workshop. So, what do you advise patients who admit that they don't want to have FOBT, like this case? So how do you deal with a person who says, I don't like the idea? What strategies can we use to address that? What additional info, particularly in her case where she wasn't high risk, she didn't have a family history, so we wouldn't be otherwise necessarily referring her for a colonoscopy. What additional information do you need after she's had the colorectal cancer diagnosed? What additional information might we need after that initial colonoscopy report? What do you think her prognosis might be? What's her 5-year survival? What do you think the treatment approach might be for her? How would we go about treating her? What sort of modalities would we think about? What would the approach be if there were secondaries in the liver? So if she either at that time or later developed secondaries in the liver, what would that mean to her outlook and the treatment approach? And how would that differ if she had rectal cancer? And finally, assuming once she completed all that treatment, what sort of follow-up and investigations would be optimal? What would be the routine care of this patient long term? So there are just some questions to think about, prompt you to think about, that hopefully you'll be able to answer at the end of this workshop.